Other activities that we can do would be more stationary activities. You want to go ahead and find an area with good traction. So a mat, like a yoga mat, is a very effective way to make sure that your dog won't slip and fall. I recommend starting with range of motion. This you can start to do pretty soon after surgery, but just make sure that you're not fighting with your pet. We don't want to cause any unnecessary stress and create a negative association with this physical therapy. It should be rewarding and positive. So again, treats are okay, just make them small, make them low calorie, but we do want this to be a very positive experience for your pet. If at any time your pet's getting stressed during these exercises, take a pause and try again another day, or choose another exercise that may be similar in the effect that it has where it may not stress your pet. Passive range of motion is a very simple exercise to do. I like to start by warming up the feet and warming up the ankle. That's usually not the area of surgery, but it may be in your dog's situation. And we do multiple repetitions. So just do 3 to 5 gentle repetitions where you're gently flexing the foot and the toes and then extending. We move up to the ankle where we're gently again flexing the ankle and extending. And more than likely your pet's probably had knee or hip surgery. So as you're moving to the area of interest, you may not get the level of range of motion from the other side. If you're not sure, do the range of motion on the normal side so you can see what your dog is capable of and understand then the differences as your dog builds and grows. If you're a righty, place your left hand on the kneecap, stabilizing the knee level from the ground so it's parallel, and then gently flex and then gently extend. Again, that range may be different based on the comfort and progression of where they are at in their surgical recovery. And so don't overdo it. Don't push to pain. We're just gonna start to do what your pet allows us to do. And then we're gonna move up to the hip. And again, we're gonna gently flex and gently extend. Hip extension is going to be really important with certain hip surgeries. And so we want to focus on hip extension as this is often left out when we're doing that. But don't push to where your dog is going to struggle, roll, bite, be stressed. Okay, just don't forget to do it. As you go through these isolated joints, you can start to do range of motion like a bicycle. And so you can start to make that more of a fluid motion, 3 to 5 repetitions of each of these motions 2 times a day. If your pet is really amenable, a maximum of 3 times a day. Another thing that can be a little bit tricky, most dogs know how to give their paw. And so if you can have your dog stand and give your paw, it's a 3-legged stance. If you can train your dog, first start maybe holding your dog under the belly and then stick the paw out and then have that stance in a 3-legged hold. That will help distribute the weight to your surgical leg. Probably won't hold it as long as we'd like, but if you want to have them hold that for 30 seconds at a time, you can do that a few times over. Other thing that will help distribute the weight to the hind end if you have hind limb surgery is to do an elevated stance. So you can get a couple of cushions or a step and you would elevate the front limbs. So now the head is at an incline and we're putting more weight distribution on the back legs. We want your dog to weight bear. Weight bearing is going to help the bone heal and it's going to build muscle. We just don't want to overstress the leg. And so doing these physical therapy activities that are very controlled, comfortable, and positive is what's going to build muscle. One other tool that you can use prior to doing those exercises, and we have a separate video for cold and warm compress and how to do that, but you can apply your warm compress to the surgical area for about 10 minutes. And usually I start doing warm compressing 2 to 3 days after surgery. But before you do these rehabilitation activities, it will help kind of loosen those muscles up. And after you're done with physical therapy, you can go back and even incorporate that cold therapy and apply to the surgical area to help with comfort after all of that exercise. But remember, slow and steady wins the race here, okay? We do not want to overdo things and we want this to be positive and helpful.